So balloon sinuplasty is primarily indicated for people that have more than 4 to 5 sinus infections per year. Now, if you have one bad year and you get 4, it doesn't mean you need a balloon sinuplasty. But if this is a thing that's been going on for you for multiple years in a row, that's a solid indication for balloon sinuplasty. Another one are medication treatment failures in patients that have already tried, a lot of medications, that have radiographic or abnormalities on the X-ray and clinical symptom scores that meet, sort of the criteria. Like we have kind of a list of things. Like they have to have these many complaints on their symptom score. They have to have these many findings on the X-ray. They have to have tried so many medications. And so that's kind of the harder one. The easy one is that, okay, I get more than 4 to 5 sinus infections per year for multiple years in a row. That potentially means you're a candidate. The second one is the harder one, which is I have to kind of go through and say, all right, what medicines have they tried? Have they tried allergy medicine aggressively? Have they been on enough antibiotics to make me feel comfortable? So the kind of the way I like to look at it is there's sort of 3 sets of people. There are people that have minor sinus disease that all they need is a little bit of medication, here and there. Then you have these people that are kind of in the middle that need medication all the time, and they may have partial response to that medication. And then you have this other group of people that have really bad sinuses that need to go to the operating room. The problem is this group in the middle. What do we do with these people? The ones that are really bad that need to go to the OR, that's easy. The ones that are kind of, okay, and they just need over-the-counter medicine every once in a while, those guys are easy too. It's the ones that are in the middle that a lot of those people have relied only on medications and would benefit from a balloon sinuplasty. The balloon sinuplasty procedure takes about 10 or 15 minutes to perform. It's done as an office-based procedure. You come in that day, you don't have anything to eat or drink for 5 to 6 hours before. We can do it with you wide awake, or we can do it with you completely asleep. The powerful thing about balloon sinuplasty is whereas when people have been on medications, those medications, they don't really fix the underlying problem. They temporize it. They're going to make you feel better while you're taking the medicine, but it's not, you don't give somebody Claritin for 2 weeks and then expect that they're going to come back and, everything's better. It's miraculously gone away. It doesn't happen. It just covers up the problem. And so balloon sinuplasty actually changes the underlying condition and makes it probable, if not very likely, that most, if not all, of their symptoms will go away. Very rarely I'll have somebody come back in and say, hey, I'm still really having a problem, this didn't work. And then, for me, and part of what that Glatz guarantee is that, you have to pay attention to that. You have to listen to your patients. You have to rescan them. If needed, sometimes you have to redo parts of the procedure in order to get them, all the way better. But that's kind of one of the things that sort of makes me a little bit different in this, is that number one, I'm really careful when I do the job, make sure I do the job right. And number two, if they come back and people have a problem, then you have to take that seriously. You have to listen to your patients, and if they need something more, you don't run from it. Don't be afraid to address the issue or blame it on the patient. I have a responsibility to do what they've asked me to the best of my ability, and so that's follow through with that. Repeat the CAT scans, try them on medications if necessary. Redilate a sinus or re-reduce the turbinates.